one of the challenges that we share together has been the persistent doctors' strike. We are all committed to a fair resolution to this dispute, fair to the Kenyans who pay for medical services. It must be fair to the doctors. It must also be fair to other public servants. Doctors occupy a very special place in our republic, alongside other public servants, the military, the police, civil servants, all who save and protect Kenyan lives. Doctors have our respect. But we also need to clarify about the consequences of their strike. The better off still have access to doctors' care, while poorer Kenyans must do without. Some of these doctors are still practicing in their own private clinics. There is no fairness in that. But it is also clear to me that the doctors' grievances will not be addressed by creating new grievances of their own. Because quite simply, two wrongs have never, ever made a right. There is a better way to do this. Fairness and compassion are at the heart of the medical profession. But other Kenyans also have legitimate concerns. Fairness to you as doctors cannot come at the expense of fairness to other Kenyans. It must be remembered that yours is a calling. Your duty is to serve all, to protect and to care for all. My government wants you to have the very best conditions, and not just for you, but for your patients as well. Yet our aim to bring world-class care to Kenya cannot be realized immediately. You must remember that we still remain a developing country with a long way to go. We're not going to be able to achieve what you want overnight. Right now, it seems to me that the doctors should pay attention to our national circumstance, and it seems to me that they should remember the higher duty to protect life. It seems to me that it would be wise for them to be guided by patience and practicality. And I need to say here quite clearly that if this round that they are now engaged with our religious leaders fails, we will be in a bit of a problem with them. And it's very clear. And we will sort them out. This one, no. Having said that, I want to commend the clinical officers and nurses who continue to turn up to work every day. Your service is appreciated by a grateful nation. You know, you have to recognize, I'm sorry to deviate, you have to recognize, we are paying these people and we have offered these people more money than even doctors in the private sector receive. An intern today is being offered more money than a medical practitioner working at Nairobi Hospital, Aga Khan Hospital, Mata Hospital. Kwani hii watu wanaona sisi ni wajinga namna gani?